Hello and welcome back. I'm Dr. Mark Lindholm again, and again, I'm so glad that you're a patient at our clinic. And I want to continue our patient education videos today and talk a little bit more about what causes subluxations. Again, our approach is for you to work along with us, and this is especially important. Subluxations affect, like I said, how your whole body functions. It leads to all kinds of pains and problems. So we want to know, what can I do to prevent subluxations and what causes them? And it's actually a common question that I get. A lot of people ask me, so what causes these problems? As we talked about with the light example in our last video, it can be gradual over time, but there are three main causes of subluxations that chiropractors have always talked about. It's physical, chemical, and emotional stresses. So let me break these down and explain a little bit about them. So physical stress is what most people think of. So a lot of the examples I used with the light. So you take a fall, you lift something heavy, the birth process, those kinds of things can be a physical stress where you can actually pull or twist or yank your spine out of alignment or cause damage to the spine. And these definitely lead to subluxations. But a lot of people don't realize that that's just part of the picture. For most people, chemical stresses and emotional stresses play a big role in causing subluxations. So these are a little less direct in the way they cause a problem. So let's look at chemical stresses, or actually biochemical stresses is a good way to put it. And this actually is kind of a bigger category. It could be things that we're exposed to in our environment, the air we breathe, the water that we drink. It unfortunately nowadays could be our foods that we eat that are processed foods or foods that have chemicals in them, or that are sprayed with glyphosate or Roundup that affect our body. So I mentioned that the nerves go from the brain through the spine out to the body and from the body back to the brain. So the way that chemical stresses can work is that it can be an indirect effect. So let's say that you're eating a diet that's like the standard American diet that's full of processed foods and lots of additives and probably has chemicals in it that are negative for our body or detrimental to our body. That could irritate your stomach and then cause what's called a viscerosomatic reflex, where it actually causes the nerves that go from the stomach back to the spine to be irritated enough that it can actually cause the spine to tighten up and then pull the spine out of place. So those nerves, remember, work both directions. They're going from the brain through the spine out to your body, but they go from the body back to the spine and back up to the brain. So chemical stresses are huge. And so as part of your care plan, we'll be talking to you a little bit about real ways that you can reduce your exposure to chemical stresses. So, but especially the foods you eat are important, the air you breathe, the water you drink, and cosmetics, things you put on your skin can be a source of chemical stress, and even how you cook your food, like what you put it in, whether it's plastic or glass or that, can make a big difference. So we'll touch on that more later, but that's a big cause of subluxations. The last one is emotional stress. And this one is much like chemical stress, that it's an indirect way that it happens. So when we're under emotional stress, we tend to tighten up the muscles and we can actually pull the spine out of place. But it's even more than that. See, the way our nervous system works is that we know through research that when we are exposed to chronic stress or distress, it's processed in our brain and feeds into our spinal cord in exactly the same pattern as actual physical trauma or injury does. So basically our brain has trouble telling the difference between actual injury and physical trauma as opposed to perceived or imagined or a mental trauma. So it can indirectly cause those subluxations or continue a pattern of subluxations when you're under emotional stress. So we also have a whole series of videos, 4 videos called Coping in a Stress-Filled World, that talk about stress in much more detail and talk about some relaxation techniques or some strategies people can use. The great thing is that the care you're getting, the adjustments that we're doing, those help to reset the nervous system. So when we do an adjustment, it improves that nerve supply going back and forth to the brain, so it tends to relax the nervous system. It takes us from that fight or flight state to a more relaxed state. with emotional stress. With chemical stresses, it tends to improve that function of our body and kind of like almost resetting a circuit breaker that might flip in your house because there's a power surge. Doing an adjustment helps that part of your body to work better. And we obviously are able to correct those physical stresses. We might also be talking to you about what are called micro traumas. So it's not just the big stresses, but it can be the repetitive things, like the way you sit at your computer all day long, or the fact that you're not just moving your body enough. People think of sitting as being restful, but our bodies are designed to move, and sitting too long alone can be a repetitive stress to our spine and nervous system. So again, I just want to thank you for watching these videos, and feel free to share them with others. And it's all about just getting you as healthy as we can, as quickly as we can.